I'd like to welcome everyone to today's FAST-TRAK training lab. Today's session is brought to you by TRAKnet Cloud. You can take your TRAKnet anywhere you have an internet connection with the TRAKnet Cloud. My name is Tony, and I'm the TRAKnet client trainer. Joining me today is Erica, one of our customer care representatives. In this webinar, we will be covering questions which you as our clients have when using the TRAKnet program. All users will be in listen-only mode, so please post all questions to the questions box on the webinar menu. And I also want to have everyone check just to make sure that they are up to date. The current TRAKnet version is on the bottom of the screen. We will be going over the most recent update, so it will be important to have that update in your system. So we're going to start off here with the MIPS MACRA quality measures. When starting for reporting for the MIPS MACRA quality measures, it is important to make a decision as to whether or not you're going to be reporting by claims or by registry. The quality measures can be reported either way, but TRAKnet's going to record it differently. So when reporting by claims, you need to have a CPT code for what you're reporting for on the claim, and TRAKnet will automatically put that CPT code in for you. And when reporting for registries, that CPT code is not needed and will not be added by TRAKnet. So it is important to decide which way you want to go with that. If you want to go claims, we'll want to select claims and stick with claims. If we want to go registry, we'll want to go registry and stick with registry. It'd be very difficult to switch from registry to claims 6 months down the road because we cannot resubmit a claim for reporting purposes. So once we've decided how we're going to do our reporting, we'll need to go to our Tools drop-down menu and then to Options. And there's a new option on the Options menu called the Quality Measures MIPS MACRA. And this is where you're going to set your reporting method, whether it's registry or claims. And again, like I said, you want to make sure that you decide ahead of time which one you're going to go with so you can set up for the one that you're going to go with. Right now, we're going to take a look at claims. Once you set, and you close, TRAKnet will switch over to where it's going to give you the claim screen. It's going to put that claim code on your invoice for you. So we'll start with our first encounter. When we open up the encounter, we're going to want to document the reported measure. So for TRAKnet, we've added in a new template category called the MIPS template category. And this has some general documentation for each of the measures. For these, it's pretty similar to any other template. You select where you're going to want to place the template, select the template that you want to use, and then with these ones, most of them will have a blank in there for you to select the appropriate information. So in this case, the patient had a BMI within normal limits or they had a BMI above normal limits. It'll be which one it fits for the measure. Now, you do not necessarily have to use our templates for reporting. We place them in there to help it be easier for documenting the measure that you're reporting. Once you've documented the measures you're reporting, you're ready to move on to reporting them. You'll head over to your Invoice tab, and there is a new tab on your Invoice tab. If the Options menu item has not been set, this tab will not be here. So if you don't see this tab, check your options for the quality measures MIPS MACRA and make sure it's set to the method that you would like to report with. For reporting, you click on your quality measures MIPS MACRA tab, and this is going to list out each of the measures that we have. The measures are going to be listed according to frequency of reporting and then a specific group for diabetic quality measures. So the first two, they need to be reported on each encounter during the reporting period. The second group needs to be reported once per the reporting period. And the third group is your diabetic codes. In this case, with claims, only the hemoglobin A1C port control is required for reporting. To the right of our measures, we're going to see a set of colored flags. These are going to tell you if the patient qualifies for the measure, if the patient does not qualify for the measure, and whether or not the measure is completed. So we can see here, my current patient qualifies for all the measures. The encounter code I have listed is an encounter code that works for all the measures. Each of the measures does require an E&M code. Some of them require specific E&M codes, so you'll see here if your encounter code qualifies for that measure. If it does not, you'll see a blue flag to let you know that does not. And then on the denominator side, you'll see a blue flag there and it'll say no. So if the patient doesn't qualify, if they're not part of that denominator, you're going to see that blue flag that it says no. To document your measure, you select the measure that you're documenting for, and on the claim screen, you're going to have a set of checkboxes. They will be grouped according to what they are, so you'll have your performance met, your performance not met, your exceptions, and your exclusions. So in this case, none of the checkboxes are checked because we haven't done any reporting. If we leave them all unchecked, we're not reporting any. What we'll be doing for reporting is selecting the one that fits what we have done with our patient. So we'll go ahead and check the performance met. And then this will change everything on the encounter screen for you to indicate what code you use to report for what measure. So you can complete a couple of different measures at the same time. It's not one measure at a time. You can go through, do all the measures that the patient qualifies. Once you have left the specific screen, so once we have left this screen here, either to review the encounter to see where we're at or to go back to the invoice, it places the CPT code on the invoice for you. This is important because if we want to go back and change one, so say maybe we selected the wrong MET code for our care plan and we need to do advanced care planning where it was discussed but the patient did not wish or was not able to name a surrogate decision maker, we need to first go back to the invoice and remove the code. If the code is not removed, you'll not be able to select a new item. Once you remove the code, you can select the new item and the code will be added to the invoice for the new item. So it is important when we're reporting by claims, if you select the wrong reporting, to come back to the invoice and change it. If you have selected the wrong one and you're still on the screen, you can change it up until you leave the screen. So it's changeable up until the point where you leave the screen. Once you have your reporting codes, you submit the claim and that reports for claims. Pretty similar to the previous PQRS codes. It is important to have your notes signed and closed for reporting. And for the report for the quality measures, we're going to go to our Reports tab and down to Quality Measures, MIPS MACRA, and that's going to load a report. This report is going to load by default to your selected type of reporting. So if you have claims selected, which we currently have right now, it's going to load 2 claims. So you'll see your measures for claims. If you execute it under a summary, it's going to show you how many people you have in your denominators, how many people are exclusions, how many you have a performance met, and exceptions, and it'll show your data completeness and your performance rate. On mine, it currently shows 0 for everything because I am on claims and I have not sent out a claim for it. So this on claims will specifically look for claims. The Details tab is going to look for who qualifies for the measures and then tell you their reporting status. So here we can see we have 4 patients that qualify for the measure. If I had sent out a claim, we would see the reporting status for the patient that I just reported on. All right, now we're going to switch over to Registry because they are a little bit different. The way to report is pretty much the same, but there's a few small differences with them. So we're going to switch over to Registry. I'm going to make a new encounter. Again, you want to make sure to document in your note that you're performing these measures. Most of them do require documentation in that visit note, so you would just want to make sure you get in the habit of documenting every one in the note. And we have that MIPS template category there that can help with documentation. It's just basic documentation on each one of the measures to indicate what you did. You just select them and select the item that fits what you were doing for the patient. Head over to our Invoice tab. and we have our quality measures MIPS MACRA. We do need to have that E&M code, so I'm going to add E&M code here. And if you notice, the list is a little bit longer. When reporting by registry, we're reporting 2 additional measures. We're reporting 2 diabetes mellitus measures, a neurological evaluation and evaluation of footwear. So there's that difference between claims and registry is there are 2 additional measures for registry. Registry will still give you the flags, tell you if your patient qualifies, if their encounter code qualifies, and if they're in the denominator. And at this point, we can still double click on the screen and be brought over to the reporting screen. There's a little bit of a difference on the reporting screen. Here we have radial buttons instead of check boxes. And we have an additional category for non-coding. This is for encounters that are not being reported on. Because unlike with claims, we're not sending out a claim. We're reporting to the TRAKnet application so we can pull a report to see who fits by registry. We need to have that extra section for we're not reporting for this patient. If we check our reported measure, we go back to encounters, it gives us our reporting code there. But if we go back to the invoice tab, you can see there are no reporting codes on the invoice. So the reporting codes do not get put on the invoice for registry, and this is very important because you, again, can't do registry for 6 months and decide to do claims because it's going to make it very difficult to meet the requirements because you'll have that 6 months of time that you weren't reporting, and you can't make up that 6 months worth of time that you weren't reporting. So if you want, you definitely want to make sure that you decide whether or not you want to do registry or do claims before you start. Sign and close our note. And that is especially important with the registry. The notes will not show as reported until the note is signed and closed on the report. We open up our MIPS MACRA quality report, and it opens by default to the registry. So we can see we have our additional measures. It's the same here if we execute. It gives us a breakdown of what we have that qualifies as a denominator, what we have for performance met, any exceptions or exclusions, and you can see here on our registry report, which I have a little more data that qualifies for it, the data completeness and the performance rate. Now, as far as the data completeness and the performance rate, these are 2 different pieces of information. The data completeness is all of the performance met, not met, and exceptions divided by the denominator minus the exclusions. So it's all of the codes that you've put in for the patients divided by the number of patients that qualify for that code. The performance rate is all of the performance met versus all the performance met and not met. So it's the performance met versus what code you put in for not met and met. So I'm pulling in 2 different sets of information. And our details will show us that breakdown. You can see here where you have the breakdown of what patients are in the denominator and what the reporting status is. So in this case, both of my patients here have a reporting status of met. The next side of the MIPS MACRA is the advancing care information. This is very similar to the meaningful use. The key difference with this is that unlike meaningful use, it's not a pass or fail event. So it's not a you either pass it or you fail it. What we're looking for is performance according to your neighbors. So we'll be looking in here. We have all the same measures as what meaningful use had. Our e-prescribing. We want to submit at least 1 medication by e-prescribing for this. We have our patient access, which is where we're sending our patient their CCDAs electronically. We have our health information exchange, which is our bringing in our referrals to our patients, indicating that we had sent that referral electronically so that your outbound referrals were sent electronically and that you sent a referral summary. Our view, download, and transmit, that's the one from the meaningful use that a lot of individuals had some difficulty with as far as this is where your patient has to view and either download or transmit their information that you send them through the HealthBall patient portal. So in this one, that would be where they go to the HealthBall patient portal and then look at their information. The next one, patient-specific education. That's completed with patient access the same way as it had been with meaningful use. Those patient education links are included at the bottom of the CCDAs that are sent over electronically. The secure messaging is the measure where the one patient has to respond back to a message that you had sent, a secure message that you had sent. The medication reconciliation, that's where our incoming referrals, we identify on our new patients that we brought in an incoming referral and we did a medication reconciliation for that new patient. And then the specialized registry reporting has been moved to a bonus score. So reporting to your specialized registries is now a bonus score. It's not a tracked percentage. It's a bonus score for participation. So each one of these is going to show you your percentage as far as what your performance is. And it's going to be compared when you send in your information. It's not a pass or fail situation with these. All right. I'm done with covering the basics on the MIPS macro. Erica, did we have any questions come up on that?
Yeah, it looks like we had some other questions. One of the questions that we had is, do we have to sign up for another registry for 2017 MIPS macro?
For MIPS macro 2017, you don't have to sign up for another registry. If you were previously signed up for a registry, and reporting to the registry is a bonus score, so it would definitely be a good idea to report to a registry for the specialized registries. Now, if you do want to report by registry for your quality measures, and you hadn't signed up for a registry in 2016 for doing so, you would need to sign up for a registry for that. So it's going to be a kind of a per situation. If you've already signed up for a registry, you don't need to sign up for the registry again. You're still signed up with the registry. If you haven't, it would be a good idea for the specialized registry. And if you're wanting to report by registry for your quality measures, you definitely would need to sign up for one if you haven't already.
Okay, thank you. How to add a referral number to a claim?
Okay. By referral number, I'm going to assume that you mean a referral authorization number. The first step we're going to need to do for that is going to our billing, go into our authorizations, and add the referral authorization here on authorizations. Once it's added into the billing section, when we create our encounter, on our invoice tab, on the claim details, there's a prior authorization number. You'll select that prior authorization number there, and that'll be sent over when you send over your claim.
All right. How to get the tax code in box 32B?
Right, the tax code in box 32B is determined by the insurance. We'll want to go to our properties, find the insurance that we need to have that tax code on, go to claim details, and we want to make sure send legacy numbers is set to true. We're going to go to our legacy numbers, click the add drop down and select facility. Select the facility that you want to have that information in for, and then select the appropriate legacy number. And then enter that legacy number into the legacy number field. That'll add that to 32B.
Thank you, Tony. The next one is how to change the provider in box 33.
All right, box 33 is the billing or rendering provider. They're both the same. If you have signed and closed the encounter, you cannot change that provider. On your encounter, that is the provider listed to the encounter, and that can be changed until the encounter is signed. If the encounter is signed, it cannot be changed. To change it before the encounter is signed, you simply click the drop down and select a different provider. If the encounter has been signed and closed, which we'll show you on the previous note I have here that's signed, you can no longer click that drop down. Once it's signed, you can't change that provider.
All right, thank you. How to correct an applied payment is the next one.
Okay, payments that have been applied can be corrected by opening the payment. So I have this payment here. We can open that payment, and whether it's an insurance payment or if it's a patient payment, what we do is we remove the applied line. So in this case, I'm removing this $30. Go back over to our show pending and apply the amount to the correct line. Once you've done that, it's just close it. And the new clicking reduction automatically saves it, so you don't need to do any additional saving. You can just close the payment.
All right, thank you, Tony. Which is easier, claims or registry?
From a standpoint of a person who works with the program, I would say both are the same difficulty level. Both require that you submit for patients. Now, it did just occur to me that there is one additional item that's the difference between them. Claims is Medicare Part B patients only. Registry is all patients. But from a standpoint on my side, both ways are the same difficulty. One's going to be when you send out your claims, and one's going to be creating that file and giving it to a registry. So they're both going to have that and submitting it to someone. But with claims, you're sending it along with your claims. With the registry, you're sending it over to a registry, but the process is the same for either one. So they're both the same level of difficulty. When we're doing our encounter, make sure to document what we're doing in the encounter. Go to the invoice and simply select the measures that we want to report on. So it's pretty much the same either way, whether it's claim or registry, it's the same difficulty.
All right, thank you. The next one here is when you add a payment with the wrong payment type, can you change it without deleting the payment?
No. When you add a payment, the payment type is locked in once it's saved. So no matter the type of insurance, once you've saved the payment, you are not able to change the payment type. If it is necessary to change the payment type, then you would need to remove the payment and re-add the payment.
Okay. When will the J-code rejection issue be resolved?
The J-code rejection issue was resolved with the most recent update that we sent out. The larger of the updates that we've sent out, the resolution was placed in there, so we should no longer be getting rejections for those J-codes. The TRAKnet application was modified so that it won't send the descriptions for those codes that are not supposed to have descriptions. If we're still receiving a rejection, please check and verify that all systems are up to date. And if we're still receiving it at that time, we would want to call customer support so we can look into that issue for you because it should have been resolved on the last update.
All right, awesome. The next one here is how to change the user's signature.
Okay, I'm not sure what we mean as far as the user signature. There's only one signature that really gets entered into TRAKnet automatically, and that is the provider signature on a note. That cannot be changed. That is generated by the system automatically. So if the provider clicks the sign and close, it's going to say the provider. If the user clicks assign and close, it's going to say the user. So it's not something that can be changed. It goes based off of the user's information when it creates that signature.
Okay, and this is more so for instance, if they are doing the signature sign and close, and at the bottom it's saying the physician's name, but it says DPM at the end, and they don't really need it to say the DPM. Is there a way to change it there?
They would need to change it on the user. So it would need to change the user's information. That pulls directly from our user. So they would need to go into the user like I have here and remove that information from here and just save it.
Okay, and just for clarification, that pulls from the username or just the first name, last name?
Give me one moment to take a look here because I believe that pulls username, but I'm not 100% certain on that. So we can check my signature line that I just did and see for sure. So it pulls the username.
All right, perfect. And the next question is how to add a modifier.
Okay, add a modifier. We're going to go to our Properties tab, go down to our Property Values category, select Modifiers, and click Add. Here you'll add the modifier and description and click Save, and that'll add that modifier to the system.
All right, awesome. And how to send separate charges on a claim.
Right, to break a claim into separate charges, we're going to use our claim wizard. So we'll put on an additional charge here where we have 2 charges. We go to our claim detail screen, go to our claim wizard, and this allows us to select the items we want to send to the insurance. It's really generally only would need to be used in an instance where you're sending to multiple insurances, such as Medicare and DMERC. But it can be used where if you need to resubmit just a single line item, you can select just that line item and send just that single line item.
All right, and can we enter more than one payer ID for an insurance, and how is the next question?
We cannot enter more than one payer ID for an insurance. TRAKnet uses the payer ID the same way as Gateway does to identify the insurance. So an insurance can only have one payer ID. Now that's not to say the same name insurance like Blue Cross, they may have more than one payer ID. In that case, you would need to add them into the system for each payer ID, as well as if you have different offices, you would want to enter them into the system under different offices. So this is where we come into the claim offices and the multiple insurances. You want to have an entity for each payer ID, and if you have more than one entity for a single payer ID, you want to make them claim offices of the main office. All right, looks like that's about all we have time for today. So we're going to go ahead and wrap up. Our client success team will reach out to those whose questions were not answered after the webinar. I'd like everyone to please join us again in 2 weeks. I have on the screen here some resources. That's our TRAKnet YouTube page. We have some new videos up for the new MIPS macro quality measures and for the ACI measures on the TRAKnet YouTube page, and also new wiki pages for those as well. So these resources can help out with those. And everybody, thank you for your time today, and please join us again in 2 weeks for another FAST-TRAK training lab. And have a wonderful afternoon.